Next speaker needs no introductions, Mani Menon, precision focal prostatectomy.
The trouble with radical prostatectomy, though, is a change in erectile function. This is a paper that is online in European Urology and looked at the potency results following radical prostatectomy over the last decade.
So our next speaker is Dr. Sternberg, promising clinical trials in prostate cancer.
Hello, I'd like to thank you very much for the invitation to this very, very interesting, wonderful meeting. I'm going to talk now about hormone-sensitive prostate cancer, and what there are a lot of very interesting, large, ongoing trials, the majority of which are international trials, trying to see if we can improve upon the results with hormone-sensitive prostate cancer.
There's a lot we could cover when talking about the online urologist, but given how the past year has gone, although I like to spend a lot of time focusing on patient acquisitions, referrals, and reputation, I think we should talk about knowledge dissemination.
In summary, erectile function was better preserved after precision prostatectomy than total prostatectomy. In focal therapy, only the index lesion is ablated. In precision prostatectomy, all index and most all satellite lesions are removed with about a 4 millimeter rim of capsule.
We know that, as I mentioned, that we need different biopsies, and hopefully that we can have this in the future with circulating tumor biopsies. And by having liquid biopsies, it will be much easier to look at patients as they're being treated, because there are differences that are produced when they're given androgen deprivation therapy, and there are differences produced when they're given other therapies.
In the past 90 days among urologists, the biggest "what are patients up to these days" type article was around filler injections of the testicles, and you can see that a local New York physician was giving comment on that. Now, this sort of thing is valuable both to practicing urologists and primary care physicians who are in an advisory role in an increasing rate to the empowered patient.